Hello, everyone, and welcome to this MHA Schools Masterclass on Addictive Behaviours among Youth. My name is Pedro Gondim. I'm Mental Health Academy's CEO and your host for this series. And joining me in this first Masterclass directly from Atlanta in the United States is Dr. Amanda Giordano. Amanda, how are you today?
I'm great, Pedro. Thanks for having me. I'm excited about this lesson.
Also very excited. This is the first of this new initiative that we're doing this year for teachers in Australia. So it's super exciting to be able to hopefully provide some content, some skills, some strategies, some takeaways that are going to help the kids out there and help improve mental health in
Definitely.
schools.
Yeah, I've mentioned it to some of my teacher friends here, and they're super impressed about this content and what you're doing. So you got some fans in the US.
All right, and for those who've joined us live now, thank you so much for joining us. We're super excited to have you with us. And for those that are watching this recording later in the future as well, it's great that you're tuning in. Now, I'm going to quickly give you an overview of your presenter for this session so you get a bit of background on Dr. Giordano. So Amanda Giordano is an associate professor at the University of Georgia who specializes in addictions counseling. She's the sole author of the clinical reference book, A Clinical Guide to Treating Behavioral Addictions, and co-author of the textbook, Addiction Counseling, A Practical Approach. She's also the author of Mental Health Academy's internationally acclaimed micro-credential courses on working with behavioral addictions and working with substance using disorders. Dr. Giordano works to advance the counseling field with rigorous research and has published over 60 peer-reviewed articles and book chapters. She also has won a few awards for her education efforts. Amanda, anything else you'd like to add about yourself?
Nope, I'm very excited to get going.
Awesome. So before we launch the presentation slides and move on to the juicy part of the talk today, let's quickly run through some of our housekeeping items so you can get around and understand a bit more how we run the webinar. So first thing you'll notice as a participant is that you cannot talk during the session, but you can use the chat and Q&A tabs on your webinar gem window to interact with your peers, ask questions during the presentation, and so on. At the end of the presentation, we'll have a Q&A with Dr. Giordano, so you can ask questions either during the presentation or at the end, and we're going to put them together and ask during the Q&A. Also, this session is being recorded, and a link to the recording will be available via the event portal shortly after the conclusion of the live webinar, along with presentation slides and a special handout we've prepared for you with a list of resources and various other things. So if you go back to the event portal after the presentation and refresh your page, you should be able to access all those things soon after, not immediately after, but usually within 5 to 10 minutes. Finally, the certificate button as well will be available via the event portal after the presentation. So once you finish the webinar, you can refresh your event portal. There'll be a button that says certificate. If you click it, it will take you to an evaluation survey for the session. It's very short. And then after that, you'll be able to download a copy of your certificate of attendance for the purpose of accruing CPD points or hours. And if you need any assistance, just email us on schools@mentalhealthacademy.com.au, or if you're live now, you can also drop a message on the chat. Woo, that was a lot of housekeeping items. Amanda, I'm going to now drop the slides into the screen and disappear, but I'm looking forward to coming back here for our Q&A segment. Enjoy.
Sounds great. Thank you, Pedro and Mental Health Academy for putting this together. I am Amanda Giordano, and I am so excited to go through this training with you all, to go through this masterclass. I think this is so important for teachers to have this information. And I really love kind of when these disciplines come together. And so how I can share some information from addictions counseling, which is my background, with you all who are working with students directly in the classroom. And I hope that you'll find this to be a really informative and useful masterclass. So you do have my email address at the University of Georgia. I would love for you to reach out if you have questions after this masterclass, or if you watch this later and want to reach out to me. I really am very passionate about advocacy and talking about these topics, and would be happy to continue the conversation or share some resources. So what are we going to talk about today? In this masterclass, I want to cover a couple of important things. First, I want to talk about addictive behaviors among youth and just give a little bit of details about those prevalence rates. What are some of the addictive behaviors that we're seeing among students and among adolescents? Then I think anyone working with youth, especially when we think about recognizing and responding to addictive behaviors, we need to have a little bit of information about the developing brain. So We'll talk about adolescent brain development and what that means for choice and reward and impulsivity. And then the big kind of takeaway from this masterclass is I want to introduce you to motivational interviewing. And so this is a communication style that has a lot of empirical support for being very effective with not only substance use and addictive behaviors, but with adolescents and work in schools. So I think it'll be a great tool for you to add to your toolbox. And then we'll end with some school-based prevention programs that if you're saying, how do I take this to the next level and maybe get ahead of some of these addictive behaviors, we'll talk about prevention at the end. So let me start by just describing what I mean by addictive behaviors. This is what we're going to spend this course talking about, not only substance using behaviors, but also behavioral addictions. So addiction can be conceptualized as one disorder with multiple expressions. So when you think about what addictive behaviors teachers may encounter among students in the classroom, in their schools, of course, we have substance use. And so the things that come to mind when we're thinking about adolescent substance use is alcohol misuse, binge drinking, nicotine use, which can be combustible cigarettes or now vaping, cannabis or marijuana use, which can be in the form of vapes or edibles, smoking joints, also prescription stimulant misuse. And so this would be misusing a stimulant medication that's been prescribed. Typically, they're prescribed for ADHD medications like Adderall or Ritalin, and misuse would be taking without a prescription or taking more than prescribed or for a longer duration of time than prescribed. And then we also see inhalant use among adolescents, which is this act of huffing either aerosols or other toxic chemicals. So substance use is a concern among adolescents, but also behavioral addictions. So these are addictions to a rewarding behavior, and that can be gaming disorder, gambling and sports betting, overuse, compulsive social media use, compulsive pornography use, non-suicidal self-injury or self-harm, which in some instances meets criteria for an addictive behavior. So teachers have a lot of engagement with students throughout the day in their classes. And why I'm so excited to be speaking with you is that teachers can be among the first to recognize and respond to addictive behaviors. That, again, the amount of time that's spent with students and developing those relationships with students, teachers can be just there on the front lines, the first to both recognize and respond effectively to substance use as well as behavioral addictions among students. So I wanted just to kind of paint a picture of what we're seeing in terms of prevalence rates of adolescent substance use. So first, presenting some data from the US, we have a very large survey that happens called Monitoring the Future, and it gives us data every year about 8th, 10th, and 12th grade student substance use. So I just wanted you to see some of those numbers here on this slide. About 15% of 8th graders are using alcohol, about 30% of 10th graders, and 45% of 12th graders using alcohol. You can see the percent that have been drunk, including up to 25% of 12th graders report being drunk. Cannabis use is something that we're seeing more of in recent years. 8.3% of 8th graders, 17.8% of 10th graders, and almost 30% of 12th graders have used cannabis or marijuana in the past year. And then, of course, we see vaping as this growing issue. We saw a decline in adolescent cigarette use over the last decade, and now we've seen this increase in vaping. Up to 28.8% of 12th graders are engaged in vaping in the past year, and that can be nicotine, it can be cannabis, it can be both, and also different e-liquids, e-juice that people can vape. You also see the amphetamine use without a prescription, hallucinogen use. So this would be things like ketamine and LSD, and then that inhalant use. So this is some data from the US just to signify that this is a prevalent concern among adolescents. But I did have some data from Australian youth as well. So looking at the National Drug Survey or the National Drug Strategy Household Survey, this is from 2022 to 2023, you can see it's split up 14 to 17-year-olds and then 18 to 24-year-olds. So if we're really looking at adolescents here, looking at that 14 to 17-year-old column, we have about 10% vaping, 5.5% engaging in risky alcohol use, 13.3% used any illicit drug in the past year. And you can see it broken down, but cannabis is definitely one that is prevalent among Australian use as well. Inhalant use is 2.2% among adolescents. So when we talk about adolescent substance use and adolescent addictive behaviors, this is really a global issue. I know I talked about the drug use, but I also just want to share some prevalence rates when it comes to these behavioral addictions as well. So my research team and I did a study where we looked at average age of first pornography exposure among American adolescents. And we found that age to be 11 and a half years old, which is, I believe, fifth grade, I think. In a meta-analysis looking at gaming addiction among adolescents in 33 different countries, these scholars found that 8.8% of adolescents met criteria for gaming addiction. Looking at social media disorder among Chinese adolescents, 3.5% screened positive. About 17% of adolescents across the globe engage in some form of non-suicidal self-injury, which is what NSSI stands for. So that's some kind of self-harm. And then among students in 9th and 11th grade who engaged in any kind of gambling in the previous year, almost 2% screened positive for problem gambling and 4% were at risk and in need of further assessment. And so that can be any type of gambling. So along with the substance use among adolescents, we see just a substantial number of adolescents are engaging in these behavioral addictions as well. So how do we make sense of this? When we talk about these addictive behaviors and potentially addictive behaviors, what are we referring to? So I want to talk a little bit about the brain. I think that this can be really useful when we are thinking about our work with students and we think about the developing brain. We really need to have an understanding of what part of the brain is being activated when a student uses a drug of abuse or engages in an addictive behavior. So as you can see on this picture, there are the two blue ovals and the orange line connecting them. That represents the area of the brain that's known as the reward circuitry. So it's kind of between our ears in the midbrain, but this is the area of the brain that is stimulated when a student drinks alcohol, when a student uses nicotine, when a student is gaming, when a student is using pornography or gambling. It is a specific region of the brain that is involved in the experience of reward. And so it moves from the ventral tegmental area up to the nucleus accumbens. Those are the acronyms you see on the picture there, and then projects into other areas of the brain. And so this particular region stimulates the release of a chemical in our brain, a neurotransmitter called dopamine. So you may have heard of dopamine. Some people call it the pleasure neurotransmitter. It's actually more complicated than that, but it is involved in the process of reward and anticipating reward and then assigning motivational value to a particular stimulus. So dopamine is stimulated in the reward pathway and continues on the path that you see in orange there, which is called the mesolimbic dopaminergic pathway. pathway. You don't have to memorize that, but if you want to throw it around at like your next social gathering, I think it can make us all sound really smart to talk about the mesolimbic dopaminergic pathway. But this is the area of the brain that is being activated when an adolescent or a student uses a drug of abuse or engages in a potentially addictive behavior. You have the release of dopamine and other neurochemicals that travel along this pathway. I like this quote. It kind of boils it all down, that all addictive drugs are addictive precisely because they share the ability to stimulate the mesolimbic dopamine system. So that pathway that we see there is being stimulated by these drugs of abuse, and that's why they have addiction potential. Now, behaviors like gambling or gaming can stimulate dopamine release in this same area. So it doesn't require the use of a substance for dopamine to be released in this area. That's why some behaviors are potentially addictive as well. So all drugs of abuse are going to increase dopamine, either directly or indirectly. And the reason why drugs of abuse are so powerful is they cause a spike of dopamine release that's more than what we would find in nature. Now, our brains are very sophisticated, and it pays attention to what causes dopamine release, because we get a release of dopamine when we eat food when we're hungry, when we engage in pleasant social interactions, when we engage in sexual activity, these things that are necessary for survival. So the brain pays attention to what causes dopamine release. When a student uses a drug of abuse and gets a lot of dopamine release, it's as if the brain is saying, oh, that must be very important to survival. Look at how much dopamine got released. And of course, we know that drugs of abuse are not necessary for survival. They're actually tricking the brain into thinking they are much more important than they are. In the addictions field, we call this hijacking the brain. And that's what's happening when students use drugs of abuse, that it's really causing this stimulation of dopamine and activation of the reward circuitry in the brain, causing the brain to pay attention to it and be motivated to return to those rewards. So chronic use of drugs of abuse or chronic engagement in these potentially addictive behaviors like gaming can lead to maladaptive changes in the brain. And we won't get into all of it and how the brain changes. I just want you to be aware that this is why substance use should be such a concern for those of us who work with youth, because it can cause these maladaptive changes to the developing brain that can lead to continued drug seeking, the loss of control over substance use, and compulsivity. So just a little bit of neuroscience to get us started here, but I hope that that's helpful in recognizing how drugs of abuse and addictive behaviors stimulate the same region of the brain, the reward pathway, and can cause the brain to really pay attention and be motivated to return to those behaviors because of their reinforcing properties. So even if you didn't really follow any of that, I hope you did, but even if you're like, okay, I think I get it, one of the main points I want to reiterate in this training is that people with addiction are addicted to changing the way that they feel. And that is very helpful for us when we think about why students might use drugs of abuse or engage in potentially addictive behaviors. Both drugs of abuse and these potentially addictive behaviors cause the release of dopamine in the reward pathway, and that induces feelings of pleasure, of euphoria, of calm, all of these positive reinforcements. So whether it's engaging in substance use or engaging in an addictive behavior, the adolescent is changing how they feel. So it provides feelings of pleasure as well as an escape from painful feelings or depressed feelings or trauma symptoms. So drugs of abuse, behavioral addictions, they're really powerful because of their mood altering effects. So if an adolescent is struggling with loneliness or with anxiety, using cannabis can help them feel good and temporarily escape those feelings of loneliness and that anxiety. So we call this both positive and negative reinforcement, that drugs of abuse and these behavioral addictions are powerful because they induce pleasure and provide an escape from pain. So keep that in mind as we go throughout this masterclass, that people with addiction really become addicted to changing the way that they feel and relying on a drug of abuse or relying on this addictive behavior as their primary means of emotion regulation, their primary means of dealing with their feelings and escaping unwanted feelings and inducing feelings of pleasure. So like I mentioned, I think it's helpful for us to think about addiction as one disorder that can manifest in a variety of ways. So if you kind of look at this tree, we have addiction at the root, but it can express itself in an alcohol use disorder or a social media addiction or a cannabis use disorder or a sex addiction. So it's really, there's a lot of overlap between chemical addictions and behavioral addictions. They're impacting the same region of the brain that rewards circuitry, causing the release of dopamine and other neurotransmitters that are implicated in the experience of reward. Both substance use and potentially addictive behaviors can become compulsive. The student can lose control over their engagement in the behavior or their use of the substance, and they can cause a myriad of negative consequences. We also know that because of the development of the brain and the stages of development and what brain maturation looks like, most addictive behaviors begin during adolescence. So why might that be? Let's take a look at adolescent development, specifically adolescent brain development, so we can understand what's going on and why a lot of addiction starts during the adolescent years. So what I do a lot of presentations for parents and just talking about digital media addiction and other forms of addiction. And I tell parents that brain maturation, it starts pre-birth, but it continues until early or mid 20s. And the parents I speak with are always like, oh my goodness. So you're saying I have to wait until my child is in their mid 20s before their brain is completely developed and completely mature? That's how our brains develop. That as a species, we're not born with fully developed brains, that they develop over time with experience. And so really the maturation process of the brain continues until about early to mid 20s. So what does that mean for adolescents? It means that adolescents' brains are not fully mature. They are not fully developed. You may have heard that before, but what does that actually mean? What does a not mature brain look like? Well, if you look at the picture on this slide, this is a neuron. This is a cell in the brain. You can see that the long tail-like part of it, it's called the axon. It has this yellow ovals on it. That yellow represents a fatty matter or a fatty sheath that wraps around the neuron. It's called myelination. And so this myelin wraps around the tail or the axon of the neuron, and it speeds up the neuron's ability to send messages and to communicate. So it's kind of a really simplistic version of what myelination or this maturation process looks like. Now, neurons are going to go through that myelination process, but it starts at the base of the brain and myelination continues all the way up to the front of the brain. The front of the brain is fully myelinated in early to mid 20s. So what this means is that starting in early childhood, we have the base of the brain getting myelinated. So the base of the brain is really responsible for a lot of primitive behaviors. It, because of myelination, is going to be able to send its messages very fast. If you think about the myelination as kind of insulating the neuron, so it speeds up conduction and the speed of communication. So that starts at the base of the brain. As it moves up, the midbrain becomes myelinated during adolescence. So during the adolescent period, we have a more mature limbic area, the midbrain, which is responsible for things like emotional drives, motivation, the reward circuitry is here. So that part of the brain is communicating very fast. Myelination has happened. There's a lot of sped up communication between these neurons in that region of the brain. But what that means is the adolescent has a faster moving midbrain, which is all about emotions, all about reward, all about motivation, and a not fully mature prefrontal cortex. The prefrontal cortex is all about self-regulated behavior, inhibitory control, goal-directed behavior, reasoning, planning. All of that is happening in the prefrontal cortex, which isn't fully myelinated until the early to mid 20s. So translate that into an adolescent. What does that mean? It means during adolescence, the limbic region, which is involved in emotions and reward, is moving faster than the prefrontal cortex, which is involved in inhibitory control, self-regulation, reasoning, and goal-directed behavior. So it's as if during adolescence, the part of the brain that says, that felt good, let's do it again, let's go for that reward, that felt really good and I loved it, let's do it, is loud. And the part of the brain that's saying, let's think through the consequences. What happened the last time you engaged in that behavior? Did it go well for you? Didn't you end up failing a test and got in a big fight with your mom and you were suspended? That part of the brain is a lot quieter. So this is what the brain is experiencing during adolescence. It is in process. It's developing. It's not fully mature. The go system, that reward system, is working fast. It's loud. The part of the brain that's like, oh, let's think through the consequences, is slower. It's softer. And so this is why I've heard people say that adolescents need a little bit of a prefrontal cortex lift or aid from adults, slowing adolescents down long enough for their prefrontal cortex to weigh in when they're making decisions. Because if we think about their brain development, that's not going to happen naturally, that we actually have a slower moving prefrontal cortex. And so this is why adolescents are more prone, they're more sensitive to immediate rewards. That felt good, let's do it right now. They're very sensitive to motivational cues. So what their brain has said, oh, that was good, let's go after that again. It caused a lot of dopamine release. I'm motivated to approach it. They're sensitive to that. There's increased reward-seeking behaviors during adolescence. They're more likely to return to a reward once they've experienced it. Adolescents are known for novelty-seeking, impulsive behavior, and risk-taking behaviors. All of this has to do with their stage of brain development. And they also have stronger approach behaviors. Let's do it. That felt good. And weaker inhibitory behaviors like, let me think through the consequences. Do I really want to do that? So anyone who works with adolescents, I think this can help us develop a lot of empathy for what adolescents are experiencing because of their brain development. Also, it's not all bad. So I tell parents this too, that we actually want adolescents to go through this process because some risk taking is needed for growth and exploration of interests and hobbies, developing one's own identity, differentiating from their family of origin, establishing independence. All of that happens during the adolescent years. So some of that risk-taking behavior is actually helpful and necessary. But the other side of that coin is it does make adolescents more vulnerable for these very powerful rewards known as drugs of abuse and behavioral addictions. So because the brain is in a state of maturing during adolescence, it's not fully developed, it's not fully mature, we see that adolescents are more prone to these rewards. And also, if they use a drug of abuse, it has broader effects because the brain is still in process. So the drugs of abuse can interrupt normal brain development in adolescence and cause more rapid and broader changes in the brain than if an adult was using a drug of abuse. So again, all these reasons why those of us who work with youth should really care about addictive behaviors. Just a few of the potential effects of substance use on the developing brain, the adolescent brain. We know that substance use in adolescence can cause negative effects in lots of different areas, on memory, on learning, on attention. It can cause negative effects on executive functioning, kind of all of that functioning that's happening in the prefrontal cortex. The speed of processing information can be affected. The ability to engage in abstract reasoning and planning for the future. These cognitive functions can be negatively affected by adolescent substance use because of the nature of the drug of abuse, coupled with being consumed while the brain is still developing and still in progress. So adolescent substance use can lead to changes in brain structure, which is really scary when you think about it, that the substance use can change the volume and quality of various structures in the brain. We've seen this with the hippocampus, the prefrontal cortex, white and gray matter. All of those can be affected by substance use during the adolescent years. We also know that the earlier an individual initiates substance use, the higher their risk of developing a substance use disorder or addiction later on. Now, what I think is important to note here is that not all adolescents who use a drug of abuse are going to end up with a substance use disorder. Those with risk factors are more susceptible to developing a substance use disorder. Some of those risk factors are things like genetics, early trauma, a co-occurring mental health concern. All of those increase an individual's vulnerability or susceptibility to developing a substance use disorder. So some adolescents who have those risk factors, who experiment with drugs of abuse during adolescence, will end up developing a substance use disorder. But even those who don't end up with a substance use disorder, even this experimental use of substances or engaging in addictive behaviors during the adolescent years can cause harm. And we know this. We know about the injuries that can occur when adolescents are using substances. There's physical harm, there's relational harm, there's financial harm, harm that comes to their academic pursuits. So yes, some adolescents are more at risk for developing addiction and a substance use disorder than others, but all have the potential of experiencing harm or injury because of using drugs of abuse. So why might an adolescent engage in substance use? I think, again, for teachers, this is really helpful to kind of get inside the mind of an adolescent and what is the draw to these drugs of abuse. The first one goes back to that slide that says people with addiction are addicted to changing the way that they feel. If there is an adolescent who is struggling with a mental health concern, struggling with trauma, struggling with some kind of disruption in their life that is difficult to navigate and difficult to cope with, and someone offers them a drink of alcohol or the use of cannabis or cocaine at a party, it will change the way that they feel. So some adolescents may start turning to drugs of abuse as a way to regulate their emotions, as a way to feel better and stop feeling bad. So we know that one motive for adolescent substance use is emotion regulation. Also, as doesn't come as any surprise, but adolescents care a lot about their peers. Peer groups become very important. Social rewards becomes very important. So they may start to model the behavior that's seen by others, and that could be peer influence. So when peers start using substances or engaging in addictive behaviors, that can be very influential. But they could also model the behaviors that they see in their home. If a parent is using substances or a parent is engaging in these addictive behaviors. Also, like we talked about, because of their stage of brain development, this novelty seeking, sensation seeking, impulsivity can lead to trying substances out of curiosity. The sheer availability and accessibility of drugs of abuse can lead to their use among adolescents. A lot of research has looked at an adolescent's expectations about using drugs of abuse, or their beliefs about it, where they tend to minimize harm and augment what they think the positive outcomes would be. So that matters a lot when it comes to adolescent substance use. And then we also see some adolescents turning to substance use as a way to enhance their performance. These so-called study drugs, which are prescription stimulants that are being taken without a prescription in hopes of staying up all night to cram for an exam, or giving them energy and focus on a paper or a test. And so all of those could be reasons why adolescents are engaging in substance use. So this is one of the things that I think could be one of the more important slides that you get out of this masterclass is, what are the signs of adolescent substance use? What I have found through talking to school counselors and parents and teachers is that if you haven't had training in this area, you might not know what to look for when it comes to signs of substance use. So here are 10 signs that you can keep in mind, that if you're seeing these things in a student or in an adolescent, could it be that they are using substances? And again, it doesn't mean that they definitely are, but it's something that we should explore and rule out when we're seeing these signs. So the first is a change in behavior. So if you had a student who is starting to act in an atypical fashion, they're more secretive, they're lying, they're more isolated. So you're starting to see unexplained behavior change that's atypical for this student. Also, if you see changes in their attitude or their personality. So now we see a lot of emotional volatility. They're disrespectful. They seem really irritable. So changes in the personality of the student that you had come to know. Has their appearance changed? So are you noticing weight loss? Are they wearing dirty clothes? You see neglect of personal hygiene, all of those things. What could that possibly mean? Are you seeing changes in their sleep patterns? And of course, you're not going to know outside of school, but are they sleeping during class? Are they very tired throughout the day? Are you seeing some physical changes, like some unexplained new smells or odors? So cigarette smoke, alcohol, cannabis, they all have these unique odors that could linger on a student's clothes, on their breath. If they're frequently getting nosebleeds, which could speak to intranasal use of substances, needle marks on their arms. So all of those really physical changes are something that we would pay attention to. Another key point for adolescents is, has their peer group changed? So we know that socializing with other peers who use substances is a strong risk factor for adolescents using substances themselves. So have they shifted peer groups? Have you also seen changes in their interests or changes in their participation in activities? So maybe they're no longer involved in things like sports and extracurricular activities and things that they used to enjoy, but now they seem unmotivated or apathetic about these activities. Are they skipping school? So now all of a sudden they're tardy or they're absent. You see this drop in grades, in their individual grades and overall GPA. And then finally, are you noticing symptoms of intoxication? Now, drugs of abuse do different things to the body. And so these symptoms of intoxication can manifest in a lot of different ways. It could be slurred speech. It could be bloodshot eyes, poor coordination. Perhaps the student is unusually talkative with high energy. Maybe they're showing signs of aggression, or they're in this sedated kind of dreamlike state, dilated pupils, drowsy, being shaky. All of these could be symptoms of intoxication of drugs of abuse. And if you're thinking, I don't know all the types of drugs and what they do, that is okay, because I made you this kind of cheat sheet here that has the different classes of drugs. So everything from stimulants, that's like your nicotine, and the prescription stimulants used to treat ADHD, depressants, which is where we would find alcohol, but also prescription medications for anxiety. We call these benzodiazepines. You may have heard of Xanax and Klonopin. cannabis, known as marijuana, hallucinogens, so things like LSD or ketamine, the opioids, so these are the pain relieving class, and they can be either prescription opioids like prescribed oxycodone and hydrocodone, or they can be heroin, and then inhalants, which are the aerosols, the gasoline, the shoe polish. So you have those classes of drugs here, and then I put the intoxication effects. So if you have never taken a class on addiction or you haven't learned about these classes of drugs, this is a way that you can kind of see what would the manifestations be if a student was using this class of substances. So for example, if they're using one of the stimulants, the nicotine, amphetamines, you're going to see increased energy, increased talkativeness. They're ramped up. They have a lot of, it's stimulating the central nervous system. So you see increased movement, insomnia. So they're not sleeping. They may be more aggressive and have restlessness and decreased appetite, dilated pupils. So I went through each, and we're not going to go through them here, but I just wanted you to have this slide so you would get a sense of what are the potential effects of using these different classes of drugs. Because again, that's something for us to know when we work with youth so that we can recognize the signs of intoxication if we have a student who is showing those signs in our class or in the extracurricular activity. All right, so now I want us to spend a good chunk of the rest of our time talking about a particular way that we can intervene when adolescents are using drugs of abuse or engaging in behavioral addictions. Now, the name can be a little misleading. When I talk about motivational interviewing, people are like, I'm not interviewing someone. Like this, why? This has nothing to do with interviewing. Actually, this term was selected as a way to show that it's not just an approach that can be used in counseling or used in medical practice. It can be a way of talking with people in any setting. And it's a way to increase their own motivation to make a change. So let me explain motivational interviewing. And I really think you're going to find this helpful in your work as a teacher, not only with addictive behaviors, but any type of behavior change. Motivational interviewing can be really effective. So motivational interviewing, I just wanted to start with a little bit of support for why it can be used with youth. Adolescents may not have had the negative consequences associated with their addictive behaviors that makes them motivated to make a change. They may actually have less motivation to change addictive behaviors than adults. So any kind of motivation-based intervention can be particularly useful with adolescents. There have been several studies done that are actually really big reviews of many little studies. These reviews or meta-analyses tell us that motivational interviewing can be effective in reducing adolescent substance use and can be used in schools. And so you can see here that this meta-analysis of motivational interviewing interventions for adolescent substance use showed small but significant effect sizes that were maintained over time. 67% of studies that looked at motivational interviewing with adolescent substance use found significant reductions in adolescent substance use, and MI has been used in school settings, showing promise for an effective intervention with adolescent substance use. So what is motivational interviewing? It was birthed out of the addictions counseling field, but it has since been applied to a variety of settings and a variety of disciplines because it is something that anyone can learn, can get trained in MI, and it is brief. It is something that can be done in a short amount of time, either as a standalone approach or in conjunction with another approach. So at its core, motivational interviewing is a way of being with people. It is a style of communication. They call it a guiding approach because you're not directing the change, but you're not just following the student wherever they want to go in the conversation. You're guiding them towards their own reasons for wanting to make a change. So the authors of this approach defined motivational interviewing as a particular way of talking with people about change and growth to strengthen their own motivation and commitment. So have you ever worked with an adolescent and tried to tell them what to do and convince them they need to change and give them all these good reasons of why they need to make a change? That doesn't always work well, not only with adolescents, but adults too. We don't tend to respond well to external sources telling us we have to change. Instead, we actually do much better when we talk ourselves into changing. So what motivational interviewing is a way of talking with people that is intentional about getting the person to consider their own reasons for wanting to make a change. So it's great for people who are in what we call ambivalence. So if you think about this word ambivalent, it means part of me would like to make a change, but part of me doesn't want to make a change. So I'm kind of stuck. I'm ambivalent. MI is a perfect approach for people that are in that stuck place to help them get unstuck by drawing out their own reasons for why they would want to make a change. So again, this came from the addictions field, but now it's been used in education, in coaching, dentistry, social work, corrections, healthcare, nutrition, management. So the most recent edition that came out in 2023, Miller and Rolnick talk about how MI is being used in so many different spaces, including schools, as a way to promote positive change. And that's really what we're going to talk about during this class. It's evidence-based. We have support for it being effective. It can be used with people from a variety of different cultural backgrounds and cultural identities. And then, like I mentioned, it can be brief. It can be one conversation. It can be used with other approaches that we know to be effective with adolescents. So let's first talk about how we get it wrong. Although it might come from a good place, when we try to convince someone or threaten someone or coerce someone into changing, a lot of times the result is that they dig their heels in even deeper and they are further from changing because now they're going against this external force that's telling them what to do. And I think all of us can relate to that in some way, that we like to make our own decisions rather than someone on the outside saying, you have to do this and here are all the reasons why. That extrinsically influenced behavior modification is really not as effective for producing lasting change. Even if someone does it just to make the other person happy, it's usually not lasting change. We also know that information and advice giving is often insufficient for actually leading to change. So adolescents who are using substances, adolescents who are engaged in these potentially addictive behaviors, they probably don't need more information in and of itself about the drug of abuse or about the addictive behavior. So in order to lead to positive changes, we need more than that. Pressuring, shaming, threatening, advising often leads to pushback. So instead, the alternative to all of this is drawing out a student's internal motivation for making a change. That's much more powerful. And so it sounds great, right? But how do we actually do it? How do we foster internal motivation among students, particularly students who are engaging in addictive behaviors? First, we have to understand that motivational interviewing is not about convincing someone to change. And that can be difficult, especially when we're thinking about drugs of abuse or addictive behaviors that have a lot of negative consequences. Those of us who are in helping professions or teachers, we want the best for our students. So when we see them engaging in this behavior that we know is bad for them, it can come from a really good place that we're trying to convince them with all of our might not to use this substance. MI is an alternative to that. So Rolnick, one of its originators, said the MI conversation omits judgments about motivation and behavior and noisy efforts to persuade or push the student towards change. Instead, it encourages the student to face her or his decisions or her or his choices bravely and move toward a decision to change. So we kind of take ourselves out of the equation, all this pressure we put on ourselves to make this student change, and instead invite them into a conversation to think about their choices and then own their own decision. So what does that actually look like? Now, motivational interviewing is a set of communication strategies. It's a style of communication, but there's a spirit behind it. There's a posture behind it that those of us using MI are going to take on this posture. So I'm going to teach you those strategies and communication skills in just a second. But first, I want us to understand the posture we should be in, or the spirit of MI behind these strategies. So first of all, MI is built on this idea that it's a partnership between the two people who are talking. So it's a partnership between the teacher and the student. They're on the same team. They're working together. The teacher actually believes that the student has expertise about themselves and their own life that they can draw from. There's also this deep-rooted acceptance. So teachers understanding that students have inherent worth and are deserving of respect simply because of who they are. So accepting them, and that's different than accepting maybe their behaviors or affirming that substance use or behavior, but it's accepting and affirming the person and their inherent worth. It's also motivated by compassion. So MI is not a way to get someone to do something or trick someone into doing something, but it's motivated by the welfare of the student and what's in the best interest of the student. So Miller and Rolnick, who created motivational interviewing, said you can't create motivation that isn't there. So MI can't be used as a way to trick people into buying a car they don't need or something that they're not actually motivated to do. It's we work from a posture of compassion. We're interested in the welfare of these students. And then finally, the aspect that makes MI unique from other approaches is the sense of empowerment. So truly believing that the student already has reasons, motivations, and strengths within them. They already have ideas for change. And the goal is to draw them out rather than impart and impress them upon the student. So we're not taking our own reasons why they should stop using substances or stop gaming and impressing that on the student. Instead, we're drawing out their own reasons for why they would want to make a change. I really love this quote. Miller and Rolnick said, empowerment is really letting go of the idea that you have to or can make people change. It is a lot of pressure if we feel like we are the ones that have to make people change. And once we let that go and realize I can't make another human do something, but I can talk with them in a way that it invites them to explore their own reasons for making a change, it's a very empowering feeling for the counselor, for the teacher who's using this approach. All right, so if we're going to talk about MI, we have to understand what ambivalence is. So I mentioned it before, but a lot of students who engage in substance using behaviors or these potentially addictive behaviors like gaming or sports betting or using pornography are going to be ambivalent about the behavior. So they feel two ways about it. So they may like it in some respects, but there might be a part of them that doesn't like it or feels dissatisfied with it. So that is ambivalence, feeling two ways about something at the same time. An example, part of me doesn't want to drink, but another part of me wants to. Or I don't like some things about how I game, but I also really like some things about gaming. Ambivalence is a normal part of the change process. We don't typically wake up first thing in the morning and say, I'm going to make a change, but we go through this state of ambivalence where we're kind of weighing the pros and cons. Think about if you were to ask a teenager who was drinking alcohol, if we were to ask them, okay, tell me some of the reasons you have for continuing to drink, just maintaining the status quo. They might say things like, it makes me feel good when I'm drinking. I have fun with my friends. I'm more fun to be around when I'm drinking. It helps me loosen up at parties and I can talk to people that I couldn't talk to when I was sober. It gives me more friends than I did. I like how it tastes and how it makes me feel. So all of those could be within the adolescent. But then if you were to ask them, so is there anything that would make you want to stop drinking? Are there any benefits to making a change where you would stop drinking? Well, I wouldn't get in so much trouble with my parents. I wouldn't have all these discipline issues at school. I'd be saving some money, and I think I would probably feel healthier and I could get better sleep. So that is an example of an ambivalent person. They have reasons why they want to maintain the status quo and not change, but they also have reasons why they do want to make a change. So this is important when we think about communicating with students from this approach called motivational interviewing, because we have to believe that within the student are both sides. And so Miller and Rolnick said it like this: people who are ambivalent about change already have both arguments within them, those favoring change and those supporting the status quo. So what happens when an adult comes to a student and says, you have got to stop drinking because of this reason, this reason, this reason? It's almost as if the student is like, but there's another side here that's not being voiced, that's not being recognized. So I'm going to share all the reasons why I don't want to stop drinking. So then it becomes this butting head situation where the adult is saying all the reasons why they have to change. The adolescent is saying, this is a complicated situation of ambivalence. You're only speaking from one side, so I'm going to speak from the other side. And this is where we see the butting heads. MI is a way to avoid that we're not going to get into that rhythm of I'm going to try to convince you to change and you're going to convince me why you're not going to change. That's the opposite of MI. So when we recognize that people who use drugs of abuse, who engage in the addictive behaviors are ambivalent, it's as if they have a committee in their minds giving them reasons for and against changing. So I'm a visual person, so this graphic makes sense to me, but it's as if a student is walking around with these thoughts in their head. But you love drinking with your friends. It's fun and it helps you loosen up. You know your drinking's gotten out of control. Think about what happened the last time you were drunk. But you need alcohol. How will you relax without it or deal with your mom? You know you won't reach your goals if you keep drinking like this, but all your friends drink. Alcohol isn't as bad as other drugs like meth. So this would be the internal workings of the ambivalent student. So walking around with reasons for making a change already within them and reasons against making the change already within them. So MI is a great tool for working with people who are ambivalent to help them get unstuck, to help them sort through those voices within them, kind of sort through that committee and end up on the change side of the equation. So MI is built on concepts of ambivalence, which we already covered, but then also the other two important concepts to make sense of MI is called change talk and sustain talk. So change talk simply means any voiced argument in support of change. So if a student expressed any desire to change, their belief in their ability to change, a need to change, or a reason to change, we call this change talk. When we're working from MI posture, when we're using MI, we are listening for any type of change talk. And it can be anything that supports change that comes from the student, not something we're impressing upon them, but something that comes from them. Like, if I keep drinking like this, I'll fail out of high school. Or I don't like how I feel after I vape. Those are examples of change talk. The art of MI is recognizing change talk and remembering it. When you hear change talk from a student, any voiced argument in support of change, we want to remember it. We might say it back to them as a reflection, and a reflection is simply mirroring back what you heard them say. So, so you're worried about your grades in high school if you keep drinking like this. So just saying it back to them, and we're going to invite more change talk. We really want the student to be using as much change talk as they can, because what we see from MI research is the more change talk that the individual is using, it does predict behavior change. So we want to draw out this change talk. However, ambivalent people are not only going to use change talk, they're also going to use sustain talk, which is any voiced argument in support of the status quo. So it could be things like if a student says, but I can't sleep without smoking weed, or but drinking helps me make friends. We aren't flustered by sustain talk. It doesn't surprise us. It makes sense that ambivalent people are going to have change talk and sustain talk inside of them. But from an MI lens, we can respond to it in a way that the student feels heard. So we heard their sustained talk, but also invites them back into the change talk side of things. So you may be thinking, this all sounds too good to be true. How do we actually do MI? And I'm going to show you what MI looks like in just a second. But first, I want to test us just a little bit to see if you can identify the change talk. So when I'm teaching my students MI, I always tell them, the student isn't going to say, hold on, now I'm going to give you a voiced reason in support of change. They're going to be talking a lot, and it's up to us to kind of look through all of the information that they're giving us and find that change talk. So an example might be something like this. Teacher says to a student, I heard you were vaping after gym class yesterday. The student says, it's not a big deal. Everyone vapes. It's not as bad as cigarettes. My dad used to smoke and he got cancer in his throat and mouth. Vaping isn't like that. It's safe. The only issue I've ever had is that my chest hurts sometimes, but that isn't a big deal. So it's just something I like to do. The student gives you all of that information, but did you hear the change talk nestled in all of that? Can you pick it out? That is what training in MI really looks like, is how do we identify and recognize the change talk when we hear it so that we can reflect it back. So we say it back to the student. We remember it because we're going to summarize it later, and we invite more of it. So if I heard the student say all this, I might say something like, oh, so you've experienced some chest pain from your vaping. Tell me more about that. So out of all of that, what I'm choosing to focus on is the change talk, because we want to highlight and give more space and more voice to the student's own reason for wanting to make a change, which is that their chest hurts sometimes. So that's what we're going to focus on. So there's a couple of skills that you can use when you're talking to students from this MI stance. Remember, motivational interviewing is a style of communicating. So it's really a way of being with our students. And it's marked by a couple of core skills. First, we ask a lot of open questions. So an open question is different from a closed question, because a closed question is going to have just a 1 or 2 word answer. Like, do you have kids? Yes, that is a closed question. How are your kids is an open question because it's drawing out more than just a 1-word answer. So we're really going to focus on open questions when we're talking to students in this way. We also use the skill of affirming. It is very motivating when we catch a person doing something good and tell them that we recognize that they're doing something good. That is actually more motivating than punishing them or calling out when they do something wrong. But when we can recognize strengths within students, catch them doing something good and point it out, that's actually extremely powerful. So that's using affirmations. Reflective listening is what I just mentioned. We call it reflective listening because it's like holding up a mirror, the reflection of what the student just said. So when the student says something, you're going to reflect it back to communicate, I heard you, I'm with you, I'm tracking with you, this is what I heard you say. Now, we can reflect all sorts of things. If a student says, I love drugs, we could reflect back, you really enjoy using substances. But from an MI stance, we're very intentional about what we choose to reflect. We are going to reflect back the change talk as opposed to all the sustained talk we might hear a student say. So reflective listening, and then finally summarizing is a core skill. So if I hear a student using some change language, of maybe they say all the reasons why they enjoy smoking weed and it helps them relax at the end of the day. It's the only way they know how to go to sleep, but they have noticed that they feel a little bit more paranoid or they're starting to feel some anxiety. In that moment, I would reflect back the change talk that it seems like your cannabis use is leading to some anxiety or some paranoia, and I reflect it in the moment. But later, after we get to kind of a natural break in the conversation, I might say something like, so let me make sure I'm understanding. And then I'm going to summarize all the change talk I heard. So I might say something like, so let me just summarize. your cannabis use is leading to some feelings of anxiety and maybe even some paranoia. It's also caused some problems between you and your parents, and you're worried about carrying this illicit substance and what it might be like if you got caught. And so by summarizing all the change talk together, that's actually really powerful, because think about it with me. If you're listening to someone talk and you're making note of all their reasons for change in the midst of all the other content they're giving you, and then you summarize all of their own reasons for wanting to make a change, and they hear it, that's a powerful motivator. It's you're just saying back to them all of their reasons for making a change all together. That can be incredibly motivating for someone to hear. So that's how we use summaries. We are going to collect all of that change talk and then present it back all at one time. And sometimes I'll hear clients say, well, I've never thought about it like that. But when you put it like that, yeah, there are a lot of negative consequences to smoking weed. And in my mind, I'm thinking, you gave me all of those negative consequences. I just listened, collected them, and then presented them back in this summary. So those are the core skills of MI. There's also a place in MI to provide some information. So there are some youth that are just mistaken about some of their beliefs around substance use or the harms, minimizing them, or I have had students say that they actually drive better when they are high and things like this, where an MI way of offering information is you ask and you say, I actually have heard some different information about cannabis use and driving. Are you interested in knowing about that research that I've read? And you respect their autonomy. If they say no, we're not going to impress upon them this information they don't want. But if you ask, they may say, okay, what have you heard? And then you can present some of this information. So a lot of MI is respecting this individual's autonomy, partnering with them. We're on the same team, and then paying attention to that change talk. So now that we've done all the background and all the context, I want to walk you through the 4 tasks of MI. Now, remember, this is brief. These 4 things can happen relatively quickly in a 20-minute conversation and a 30-minute conversation. It can be something that you, again, integrate into other ways of working with students. But these are the 4 tasks, and they build upon each other. The first task of MI is engaging. You're going to establish a trusting relationship with this student that's built on affirmations and respecting their inherent worth. Then you're going to focus the conversation on a specific topic that for today's presentation is addictive behaviors. Then you engage in what's called evoking, which are specific strategies to draw out the student's change talk. How do we invite them to give us their own reasons for making a change? And then finally, we move into planning. How will you actually make this change? What would it look like to stop gaming? What would it look like to not use pornography or not vape anymore? How would you actually do it? So those are the 4 steps of MI. I want to highlight this quote by Miller and Rolnick because I think it's really important that MI's focusing, evoking, and planning tasks have clear directionality to them. After the initial engaging, there is intentional strategic movement towards one or more specific goals. So I think this is important that MI at its core is about moving people towards positive change. And so that's why it's used with a lot of different types of behavior change. That's why it's used in addictions and in nutrition. It's about helping people work through ambivalence to make a change in their behavior. And let's talk about what that looks like. So just for the sake of time, I'm not going to dive into every aspect of this. I'm going to give you some resources at the end where you can really dig into MI if you want to learn more. But the first task is engaging. We want to develop a relationship with a student that's built on authenticity, respect, genuineness. We really want to try to understand the inner world of the student. So what is it like to be this student? What are they experiencing? One question that is useful for us to kind of explore is, What does substance use or what does this addictive behavior do for this student? Why are they using? Why are they engaging? Is it to deal with their depression? Is it to escape these feelings of loneliness? Is it to feel powerful and feel worthwhile? What does it do for them? So we're really trying to understand the student. It's not one size fits all. We don't just say, oh, there's another student who vapes. Everyone is engaging in these behaviors for a specific reason. They serve a specific function. So trying to understand that. And then during the engaging process, we're reflecting well so that the student knows we hear them and we understand. So we're not judging them. We're not evaluating them. We're simply trying to understand the lived experience of this student. And so we do that by reflecting, by saying back to the student what we heard them say. I like this description from Miller and Rolnick's book that reflecting could even be continuing the paragraph. So rather than just rephrasing the person's words, you're offering what might be the next sentence in the paragraph that they haven't said yet. Isn't that a powerful way to engage with someone? Like, I'm hearing you, I'm in your inner world, that I can actually guess at the next sentence that you haven't said yet. So this is a way of deep connection and displaying to a student that we hear them and we understand them. Some things to avoid when we're engaging is trying to persuade the student, evaluating them, or blaming others, putting some sort of label on them, or acting like you're the expert and you know what's best for them. Instead, we're communicating that we think you, the student, know what's best for yourself, and I'm helping you just explore that. So during this engaging stage, what can we do with a student? So it's important for us to understand what motivates them. And so what does the student care about? Is it friends? Is it athletics? Is it their health? Is it their career? Is it finances? Is it their family? What's important to them? What matters most to them? So what do they value? What are their goals? That can be really helpful later on when we're looking for sources of motivation. So just having a dialogue with a student about what's important to them, what matters to them, and what they value. Then moving into focusing. So this is when we draw the conversation specifically to the substance use. And so this could be something that the student already knows this is what you're meeting to talk about. It could be something you bring up and say, listen, I found out that you were caught vaping yesterday, or I found out that the reason why you're sleeping in class is that you're gaming all night. So getting to the point that you're going to focus on in this conversation. And if a student is less than willing to have that conversation, you could start a little bit broader, like, what does the student want to be different in their life? Everyone wants something to be different. Everyone's motivated by something. Miller and Rolnick said no one is unmotivated. So what is the student motivated about? Even if it's, I don't want to be here talking to you. I don't want to have any more negative consequences at school. I don't want to do in-school suspension. Okay, so let's talk about what prompted that. And you don't want to experience that anymore. I don't want you to experience that either. So let's talk about the vaping or the alcohol use that led to it. Now, one of the things that I think is so powerful in our work with adolescents, it's great for adults too, but specifically with adolescents, if we explore the adolescents' values and their goals. So what would they like to be different in their life a year from now? 5 years from now, 10 years from now? Do they have educational goals? Do they have occupational goals? Do they have relationship goals? Do they value aspects of their spirituality, of their health, of their relationships with others? If you were to explore a student's goals and values and then draw attention to their addictive behavior, that creates what's called value behavior discrepancy. So if a student goes through all these things that they value, so honesty, their family, their health, their friendship, their faith, all of these things, and then you bring up their drinking behaviors, it's very easy for them to see a discrepancy between their behavior and what they value. And that's an uncomfortable place to be. None of us like to behave in ways that go against our deeply held values or go against our goals. So in the same way, asking the student, where do you see yourself a year from now? What would you like your life to be like 5 years from now? If you were successful in these 8 different arenas, what would it look like for you in terms of your physical health, your family, your relationships, your spiritual life? And you then hold up their drinking behavior. They see this goal behavior discrepancy. And again, we don't like to live in ways that we know go against our own personal goals. So that's a really motivating strategy to use with adolescents, is exploring their goals and values. And when we do that, it becomes very apparent how their addictive behavior contradicts those goals and those values. So that can be another way to focus the conversation. Also, just clarifying goals that aren't well defined. So if a student says, I don't want to feel this way anymore. So what is this way? And how would they know if they weren't feeling that way? What do they want to feel instead? Or I want things to be better at home. What does better at home mean? So helping them to really articulate, what are their goals? What would they like to see different? What do they value? And then to what extent does their addictive behavior align with those things, or is it unaligned with those things? And that's how we develop that discrepancy. So this is just highlighting the importance here of exploring values, goals, and beliefs. Herman said, children, like adults, prefer to experience consistency between their actions and their beliefs and values. So even doing what Miller and Rolnick called a values card sort, where you print off all these cards that have different values on them, give them to the student, ask them to sort them of most important to me, somewhat important to me, not at all important to me, highlighting the ones that are most important to them, and then seeing if their addictive behavior aligns with those values that are most important or is unaligned, can be very motivating for making a change. All right, evoking. This is really the kind of strategy part, the intentional part of communicating with students about change. Rather than trying to convince them, persuade them, threaten them, scare them into changing, we instead want to draw out students' own reasons for making a change. So how do we do this? There's a couple of tools that we can use that would strategically and intentionally increase the amount of change talk that a student is communicating as compared to the sustained talk. So the goal is to draw out as much change talk, their own reasons for change, as possible. One simple way is just asking open questions, the answer to which is change talk. So asking questions like, so what concerns you about your drinking? Or what might be the advantages of giving up sports betting? We're asking questions in a way that the answer is going to be change talk. Now, this sounds very easy, right? But a lot of times we ask questions, the answer to which is sustained talk. Like, why haven't you stopped drinking? Why are you still doing this? The answer to that is going to be all the reasons why they like drinking, what drinking does for them. But if you were to ask, what concerns you about your drinking, or what would be an advantage to changing your relationship with alcohol, that's where you start to get the change talk. So we're strategic about the types of questions that we're asking. There's also another tool we can use called the importance ruler question. So this is when we ask the student, how important is it for you to make a change to your gaming behavior? On a scale from 0 to 10, with 0 being not important at all and 10 being the most important thing I could do. How important is it for you to change your gaming behavior? Let's say the student says 3. It's about a 3 on that importance ruler. You would respond intentionally with, so why did you say a 3 instead of a 1? Or why did you say a 3 instead of 0? That forces the student to consider the reasons why they're at a 3 as opposed to a lower number, the answer to which will be change talk. So they might say, well, I said a 3 because I know I'm not getting any sleep and I'm tired all the time. Or I said a 3 because I'm starting to feel not as healthy, or I don't have any friends. So they're going to start giving you reasons why they would want to make a change. If you were to say, why did you say a 3 instead of a 9? Then they're going to give you all the reasons why it's not important to make a change. So this is the intentionality of MI, that we are asking questions, we're using tools that specifically draw out reasons for change, the student's own reasons for change. A couple other things we can do is explore extremes. So what's the best possible outcome if you were to make a change? Well, I guess the best outcome if I stopped gaming is I would have a lot more money. I would maybe have more friends in my neighborhood, and my eyes wouldn't hurt as bad. I wouldn't have this vision issue that I'm having because I game 8 hours a night. Or you could ask a question like, what is the worst outcome that could happen if you don't change? Well, I've actually thought about how I might not graduate and I might fail my classes, or my parents might kick me out of the house. So you're having them think about the best outcomes for making the change and the worst outcomes for not changing. Again, these are just tools to draw out change talk. Looking backward and forward are kind of similar. It's what was life like before the substance use or the addictive behavior began. So what was life like before you started using substances? Or imagine life in the future without pornography. What might that be like? So you're getting them to think about, if I do make this change, what could be the benefits? What are some reasons why I might want to make that change? Exploring goals and values comes up in every stage. This is an important part of MI. You already know about that. And then the directional reflections. Remember I said that your student is going to give you a lot of information at any given time when you're having a conversation with them. What you choose to respond to matters. So out of all the conversation, out of all the words and the stories that they tell you, if you can hone in on the change talk, recognize it when you hear it, and that's what you choose to reflect back, the student is not only going to say the change talk, they're going to hear their own reason for making a change reflected back to them. So they're getting it twice. So again, very motivating. So I always use this image. I never know if it really goes over the way that I want it to, but what I mean here, Miller and Rolnick talk about reflecting change talk in a way of picking out these flowers. So if you look at this side of the image that just has all the gray kind of weeds, and then you see some roses in there, that's like all the content that a student could give you. And the gold roses, that's the change talk. So we're sifting through, almost like mining for gold. We're sifting through all the content the student gives us, and we are honing in on those reasons, those desires, those beliefs, and their ability to make a change. We reflect it back as soon as we hear it. And then later, we're going to present this summary to the student where we've collected all of their change talk and we present it back to them all at one time. So let me make sure I'm getting this straight. So if you were to stop gaming, you would save money. You probably would have a better relationship with your mom and dad. You would maybe have more friends in your neighborhood and you would feel healthier. Do I have that right? And again, that's very motivating for the adolescent to hear all of their own reasons for wanting to make a change communicated back to them. So that's what the evoking step looks like. And then finally, we have planning. I'm actually going to skip responding to sustained talk just because of time, but you have this slide. If a student is not giving us any change talk, if they're only using sustained talk, we can just respond very simply, like respecting their autonomy. If the student says, I'm not going to stop smoking, you say, it's really your decision. No one else can make you do it. So there are ways we can respond to sustained talk as well that are MI congruent. All right, so planning. When you start to hear this student using more change talk than they do sustained talk, which can even be at the end of one conversation, then we move into planning. And planning is just like it sounds. So we're going to summarize all of the change talk that we hear, and then we're going to ask the question, so what do you think you'll do? Again, we're not stepping into that expert role of telling the student what to do. We're going to let them have autonomy over their own experience and allow them to figure out the next step. So Miller and Rolnick say, it's not a plan until the person's on board with it. And that's best accomplished by having them actively involved in crafting it. So what does it actually look like to make this change? If you were to stop gaming, what would you need to do this afternoon? What would you do this weekend? Would you need to take apps off your phone? And helping them really think through, if you were going to make this change, what would it actually entail? And it could be that you write this down, that it's a concrete change plan that is written down for the student with the student. And again, there's a lot of ways we can help them. If a student's kind of stuck on, I'm not sure how to make the change, we can present what's called a menu of options. So we're not telling the student what to do, but we are helping them think through this menu of options and letting them choose. So we know that people feel a lot more ownership of a change if they're able to make the choice themselves. So a menu of options is giving some ideas of what they could potentially do, but allowing them to make the ultimate choice. So an example of a menu of options, you might say to a student, it sounds like you want to cope with your anxiety in a way other than drinking. There are a lot of options that seem to be helpful to people who share this goal. Developing relaxation techniques, starting an exercise plan, diaphragmatic breathing, working with a counselor, engaging in spiritual practices. You also mentioned some strategies that could help, like taking a walk outside or calling your best friend. Which of those sound like something you would like to try? So again, even in the planning stage, we are respecting the autonomy of the student. We're letting them make the choice, but we are perhaps providing some options that they're just unaware of. And we do have some expertise that we can share just as people who have more experience. So making a concrete change plan. There's actually several of them online of a template of how to make an MI change plan. These are some examples of what they entail. But that is the basics of MI. You're going to walk through those 4 tasks using your skills, using open questions, using reflections, using summaries, catching the client or catching the student doing something good and affirming their strengths. So that is MI in a nutshell. Again, I'll give you some resources here at the end. But just in the last few minutes that I have, I want to highlight a couple of things around intervention and prevention for student addictive behaviors. One thing that I think is important for school staff, teachers, counselors, and administrators to talk about is what is the best way to respond to students' addictive behaviors. This is a popular topic of conversation right now, and I think it's healthy and helpful for members of the school community to be having this discussion of what do we want the response to be for a student who's caught vaping at school, or a student who has alcohol, using alcohol at school, or using pornography at school. There can be exclusionary discipline practices or restorative approaches. Restorative discipline approaches are becoming really popular in conversations about how do we respond to student infractions, and that could be addictive behaviors or other discipline issues. If you haven't heard of restorative approaches, there's a lot of definitions out there, but I like this one. Restorative discipline reflects a whole school ethos encompassing principles and practices to support peacemaking and conflict resolution through healing damaged relationship and making amends where harm has been done, while preserving the dignity of everyone involved. And so, again, that sounds like this kind of abstract goal, but what we're seeing is that exclusionary practices, discipline, can be really pushing students out. So think about expulsion, out of school suspension, even arrest. When it comes to addictive behaviors, sending a student away, pushing them out of the school can be detrimental. They have more access to the substances or the behaviors. It changes the student's self-worth and their self-image. It can create stigma. It can increase disengagement from school or strain the relationship with school, and they can start falling behind academically, again, while having more time and access to engage in the addictive behavior. More restorative approaches are designed to pull students in with a focus on reconciliation, relationship building, making reparations. You may have heard of talking circles or peace circles, ways to restore relationships and creating ways to draw the student back into the school community. So the goal with these restorative discipline approaches is to increase the student's attachment to school, foster more connection, build relationships, and allow the learning process to continue. So there's been some examples of using these restorative practices, these alternative responses to exclusionary discipline, specifically around student substance use. There's a program called I Decide, and it's for an individual or a group. It's 4 modules that provides information about drugs of abuse, teaches important life skills, helps the student identify their goals and values. So that can be an alternative to out-of-school suspension or expulsion. There's also been a review of these restorative practices in the US, and schools that are using them, we see a decreased number of suspensions, expulsions, and referrals to the police. So this is an ongoing discussion that people are having around what is the best way to respond to a student's addictive behaviors, whether that's vaping, whether that's pornography use or gaming. How do we respond in a way that best supports the student? So I encourage you to just have this conversation in your schools. I also think it's important to have a conversation about digital media use in schools. So to what extent are screens being used in your school and in the classroom? There's a lot of information right now coming out about digital media overuse and digital media addiction. And not all students who use digital media are going to end up using compulsively and have those negative consequences, but some will. So we really want to think about, how are screens being used in the school? Are they necessary? Is it perhaps creating opportunities for some students to become dependent on screens, to use them compulsively? Also, I think it's important for us, especially as educators, to think about, what is a student not doing when they're using a screen, whether that's in school or at home? We know that learning occurs through diverse, enriching experiences. And so we know the brain's development is in part experience dependent. So needs to have these experiences in order to create the neural pathways of learning and creating those strong connections and new neural connections. So to what extent are screens being used? And again, what's not happening when students are on screens? Are we also providing digital media literacy for students so they know how to engage with technology in a safe and responsible way? So just some more things to think about, especially with the rise of these technology-based behavioral addictions like social media addiction, gaming addiction, pornography addiction, online shopping, online gambling. We have to consider the use of digital media in schools. And then just for the sake of time, I'm going to just mention some prevention strategies. So there are a lot of protective factors against addictive behavior. So we know that there are some things that decrease the risk of an adolescent engaging in substance use or addictive behaviors, like having a non-using peer group. That's a very important protective factor. Parental attachment, parental monitoring, secure attachments, and strong connections with a support group, resiliency and grit, this kind of perseverance and passion for long-term goals. Religion and spirituality is a protective factor against addiction and substance use. Overall wellness, overall life satisfaction, pro-social or altruistic behaviors is a protective factor. Being able to regulate your emotions, being able to identify and label and then modify how you feel without turning to a drug of abuse or an addictive behavior is another protective factor. Coping skills, self-efficacy. There's a lot of things that in the schools we can foster more of, knowing that they are protective factors against substance use. Also, schools may want to engage in specific prevention programs. So this would be classroom lessons or school-wide instructions or school-wide initiatives with the goal of preventing that first use of drug or drink, the first engagement in an addictive behavior. There are lots of different types of prevention programs, but they have some common core elements, like teaching students social skills. So how do they refuse an offer for drugs of abuse? How do they resist the social influence from peers to use substances or engage in addictive behaviors? providing psychoeducation about drugs of abuse and behavioral addictions that's accurate. So not fear tactics. Adolescents, students are so smart. And if we only talk to them about worst case scenarios with substance use, the first time they meet someone who uses a drug that doesn't have that worst case scenario, they're going to dismiss everything that they heard. We need to instead present accurate information about the potential risks associated with substance use and addictive behaviors, as well as some normative education. So kids always overestimate how many people are engaging in these addictive behaviors. So showing some actual data about how many people are not using substances in your school, how many people are not engaging in these addictive behaviors in your school can actually be a really helpful form of prevention. Also, analyzing marketing and advertising strategies that target youth. Youth really don't like to be manipulated. So if you were to highlight a tobacco ad or an alcohol commercial and say, what tactics are they trying to use to get you to think smoking is cool or drinking will make you glamorous? And that can be a helpful part of prevention. And then eliciting the student's own reasons not to engage in drug use or addictive behaviors. I wanted to show you just, we also have some elements of prevention programs for digital media addiction as well that are starting to be incorporated in schools. So some overlap with the last slide, but some new information like education about technology and the risk of addiction when it comes to digital media use, helping them develop digital literacy, which is how to be safe and responsible with technology. And then both prevention programs for digital media and for other addictive behaviors include developing self-control, helping youth develop emotion regulation skills and coping strategies. So you have some slides for some specific prevention programs that have been used in schools, like Catch My Breath is a youth vaping prevention program for middle school, and Keeping It Real is another prevention program against substance use for elementary and middle school. Also just developing emotion regulation skills. There are programs that are specifically designed for being implemented in schools that help develop students' ability to manage their own emotions, tolerate distress, and help themselves cope and self-soothe. Those programs can actually be prevention against addiction and substance use, even though the focus is on fostering and developing emotion regulation skills. So that could be another prevention program in schools. And then helping students develop coping strategies. So a lot of times, these are things that have to be learned, that students have to learn. What does make me feel better when I'm feeling sad or lonely or depressed or anxious? And so helping students think through all the coping strategies that exist and trying a few on and developing some self-efficacy around the use of coping skills so they don't turn to drugs of abuse or addictive behaviors to cope with life's adversities. So that's another prevention skill. I don't have time to talk about it, but I do think if you're a teacher working with parents, it can be really helpful to help them develop a family digital media plan. So how are they engaging in digital media use in the home? If you are interested in one of these plans that you want to give to parents, you can email me and I'm happy to share an example of a plan with you that I created. There it is. There's the QR code that will take you to that plan. And this can be something that you talk to parents about and say, just like anything else, kids need limits and boundaries when it comes to technology use and digital media use. And so come up with a family plan that everyone signs about times when no one will use digital media, limits on digital media use, what types of digital media are okay in this household that align with our goals and values. So that can be a helpful tool for parents and families as well. So I just wanted to end on this slide before we go into Q&A. Two quick things. One is I do research on behavioral addictions. That's one of my specialty areas. So the QR code here is to my author Facebook page where I try to keep it updated with information about behavioral addictions. I also wanted to recommend, if you are interested in motivational interviewing, there are two books that I think could be really helpful. One is the seminal motivational interviewing text by William Miller and Stephen Rolnick. It's on its 4th edition. edition. So it just came out in 2023, but it's called Motivational Interviewing, Helping People Grow and Change, I believe is the subtitle. But Motivational Interviewing by Miller and Rolnick, published in 2023. That is the go-to source if you are interested in MI and want to learn more about it. There's also 2 books called Motivational Interviewing in Schools. One is by Stephen Rolnick, which I think is excellent. It's a great resource for teachers to say, how do I start implementing MI into my everyday communication with students around all types of behavioral issues, not just substance use, but it can even be involvement in class and academic performance. So I think Motivational Interviewing in Schools by Stephen Rolnick, and then Motivational Interviewing by William Miller and Stephen Rolnick are 2 great resources if you want to learn more about MI. But you have my email address too, so please reach out to me if there are other resources I can help direct you to. Motivational Interviewing is kind of in the public domain, that there is the Motivational Interviewing website has a lot of handouts and the values card sort and change plans and all sorts of things to help you use MI. So that's another resource that I think could be really helpful for you, is just the Motivational Interviewing website. So I think that's all for me, Pedro, if you want to come lead us in some Q&A.
Yeah, thank you so much, Amanda. That was very insightful and just so much information to review, go through, and apply. Lots of practical stuff. I just want to make a point that I feel pretty sorry for your tiny little dinosaur that's strapped in your QR code. He looked sad and lonely, but that's
listen, it took me forever to learn how to make that, so I'm very proud of that little dinosaur.
Yeah, you put a maze, but you can't fit into any of the parts, so it's kind of unfair. Anyway, that shows you the dark side of Amanda. For those of you who don't know, she tortures animals for digital torture. Thank you so much. So, for those of you that are connected with us right now, if you can submit questions via the Q&A tab, just write them down, drop them in, and we'll insert them into our discussion. I'm going to put the slides away for a second now, and the resources that Amanda mentioned as well, they are going to be in the handouts, all of those textbooks that were mentioned, and there's links to articles, videos, and various other resources. So they're already available via the event portal. If you're watching this live, you can already go there and download a copy, as well as a copy of the slide presentation. And if you're watching this in a month, then they're already there. You might have already downloaded them. Now, Amanda, I'm going to start with a few prepared questions here, and we will slot in questions from live participants as we progress. So the first one, you've already mentioned this at the start of the presentation a bit, but I thought that we could just bring it back to the fore because it's such an important thing to ask, which is how can we differentiate between normal adolescent behavior and signs of addictive behaviors like gaming or social media overuse? In your experience, what are the like 2 or 3 main factors that you see happen with students?
Awesome question. I think it is a really good question because we don't want to over pathologize and start throwing around the term addiction when that does not fit. Instead, there are 4 hallmarks of addictive behaviors, and they all start with C. So this is the 4 C's model. And my students really like it. It's easy to remember. But if the behavior becomes compulsive, meaning that it's not intentional and planned, but it's the result of this like gut level urge, so they may engage in the behavior in inappropriate times or risky times or dangerous times. Compulsivity is the first hallmark of addiction and addictive behaviors. The second is loss of control. So when the adolescent starts engaging in the behavior more and more, with longer durations of time, more frequently than they intended, they may put limits on their behavior, like I'm only going to game for 1 hour, but they can't hold their own limits. They get to maybe being secretive about how much they're engaging in this behavior because they experience this loss of control. So compulsivity is the first sign, loss of control, engaging in the behavior more frequently than they intended for longer durations of time than they intended. The third hallmark is continued engagement despite negative consequences. So a lot of times when we engage in a behavior and then experience a negative consequence, we change the behavior. We don't want to experience that negative consequence again. addiction, because of that loss of control, we're experiencing the negative consequences, but we can't change the behavior. So we continue despite those negative consequences. And when it comes to things like gaming, gambling, social media, the negative consequences we see are financial, they're physical, they're relational, they're emotional. So we see a lot of different types of negative consequences, but they're continuing to engage despite them. The fourth C is craving. So when the adolescent is not engaging in this behavior, they are craving it so much so that they might be mentally preoccupied with it. So it's hard to stay in the present moment because they're thinking about the last time they gamed or the next time they're going to game, and it is all consuming. So they have this craving for it and this mental preoccupation with the behavior. If the 4 C's are present, that should alert us to the fact that this might not just be high engagement in a behavior or enthusiastic engagement in a behavior, but instead meets the criteria for a behavioral addiction. And teachers and parents don't have to be the ones to make that decision. If you take the student or the adolescent to a counselor or a social worker or a psychiatrist or psychologist, we can do formal assessments where we'll see if they meet criteria for a behavioral addiction. So those are the signs, those 4 C's that we should be on the lookout for that could mean that this is an actual behavioral addiction and not just high involvement in a behavior.
Thank you so much, Amanda. Very useful. And we actually have that resource, the 4 C's of behavior addictions, in the community, in the teacher toolkit section of the MHA schools community. We've also included that in the handout for ease of access. And I've dropped a link here on the chat as well for those that are live with us right now. Next question, Amanda, is, are there particular personality traits or risk factors that, whoa, hold up a second, my little note has disappeared. Here we go. There we go. Are there any particular personality traits or risk factors that make some students more vulnerable to developing addictive behaviors?
Awesome question. So there are risk factors that we know are precursors to addiction that make certain individuals more susceptible, more vulnerable to addiction than others. Some of them are personality traits, like we know that sensation seeking and impulsivity or difficulties with impulse control are related to addiction. Genetics accounts for 40 to 60% of addiction among individuals. Also, histories of early trauma. There's a robust, strong relationship between early trauma or adverse childhood experiences and later addictive behaviors. So the other risk factor is mental health concerns. So we know that there are some mental health concerns that increase the vulnerability of addictive behaviors. When we think about, just off the top of my head, like gaming, we know that students on the autism spectrum, students with ADHD can be more at risk for some of these addictive behaviors. So those are the risk factors that we really think about. We look at early trauma, genetics, mental health concerns, some personality characteristics like the sensation seeking and the impulsivity. But yes, not all students have the same degree of vulnerability to developing addiction. Unfortunately, there are these risk factors, some that we're born with, some that we might develop through experience, that make some people more susceptible to addiction than others.
Have you observed any gender differences when it comes to addictive behaviors and how they manifest among adolescents?
Yes. So there are gender differences when it comes to the type of addictive behavior. So overall, we see that more males tend to engage in substance using behaviors than females. More males tend to engage in gaming disorder, where females tend to engage more in social media addiction. Males engage in more pornography addiction. But I get a little nervous about kind of questions about gender, because across the board, we see people developing these addictive behaviors. But there are some trends that, like when it comes to adult addictive behaviors, that women are higher in like the benzodiazepine use, while men are higher in the alcohol use. But men and women, genders across the board, are going to experience these, and they have potential for developing addictive behaviors. But yes, we do see some trends in the type of addictive behavior that might be more like higher among those who identify as male compared to higher among those who identify as female.
Thank you. What about social consequences of addictions? Is there a correlate between them and issues like bullying, isolation, or school avoidance? Have you come across any studies or any information around that?
Such a good question. So yes, we see a lot of interconnectedness between these different behaviors. One that I have studied personally, we have looked at the association between cyberbullying and social media addiction. Cyberbullying occurs on social media more than some other mediums. And so there's a lot of cyberbullying that's happening on social media platforms. So we did find that adolescents who scored higher in social media addiction were also more likely to be perpetrators of cyberbullying. So we've found some overlap there. And then another study my research team and I did, we looked at sexting behaviors and pornography use among adolescents, and we found a significant correlation between looking at pornography and engaging in sexting behaviors, that the more pornography an adolescent viewed, the more likely they were to engage in sexting behaviors as well. So I do think there's a lot of overlap. There's also, when students are using substances, it can cause erratic behaviors, it can cause aggressive behaviors, it can cause really isolating and secretive behaviors. So that's a sign of adolescent substance use too, if you're seeing that aggression or you're seeing that isolation. So I do think we really need to pay attention to the behaviors and how they might connect to the addiction, but also knowing that engaging in some of these behaviors might increase the propensity that they engage in other behaviors that could be maladaptive, like cyberbullying or sexting.
Thank you very much, Amanda. Let's say someone just joined the session and skipped everything before, and they just have one question, which is, what practical steps can teachers take to prevent students from developing addictive behaviors related to social media, gaming, or self-harm, for example? If you had to answer that question, if you had to sum that in one answer, what would you say to teachers?
Well, I truly believe teachers are remarkable and so necessary, and they can do so much good, and they are doing so much good. I think having some education around addiction, like everyone who's viewing this, so that they can engage in these conversations with students in a way that is not shaming and evaluative, but really coming from a place of compassion and empathy, is such a corrective experience. I think there's a lot of people in the student's life who are telling them, just stop doing that, don't do that, and maybe engaging in a lot of advice giving and information giving, where teachers who approach it a little bit differently, like from an MI stance, and come at it with this compassion and empathy and trying to understand what it's like to be the students in their lived experience, I think can be so powerful as a way to intervene. When it comes to prevention, I think having the knowledge can inform how do we talk about digital media addiction and substance use in a way that's helpful in preventing initiation among adolescents. And there's a lot of empirically supported ways to do that, but teachers have to be aware that they exist and that they can use some of these prevention programs. Also, I think if they are working in a school that's maybe like, we don't necessarily want to advertise that we're doing substance use prevention programs in our school, you can go kind of the indirect route and say, okay, then I want to help foster emotion regulation among students. I want to help students become more aware of what they're feeling, putting a label on it, and then effectively changing how they feel, either through self-soothing or distress tolerance. That's actually preventative work against addiction. That doesn't even have the word addiction in it, but you're saying, I want to foster and cultivate this well-known protective factor against addictive behaviors. So I just think there's so much that teachers can do. And I am very hesitant to put any more on teachers' plates because I know that there's so much they're already attending to. I think having this information and even just being able to recognize the signs of addiction when it shows up in a classroom, if they're able to look at a student and say, their behavior has changed, their personality seems different, I'm noticing these physical signs I can't really make sense of, and they refer that student to the school counselor or school psychologist, that could change the trajectory of that student's life. So I just think being aware, recognizing it, having this information about addiction is so helpful. And again, that's why I was just thrilled when you said you wanted to do this session, because I think teachers are just in prime positions to really support students in this way.
Thank you, Amanda. I've got a double question. First, with regards to preventative efforts, how do you involve parents in it? What's sort of the conversation that you have with parents? And I guess part of it, of prevention, may be learning a bit more about the student, their background, and what's going on. If you perhaps have identified there are some signs here that this student may be at a risk factor, maybe I should talk to their parents about it. It's a very sensitive topic because you're crossing the line between pathologizing and just being concerned, and you don't know what to expect by talking to parents. You don't know what their perspective on the issue will be.
Exactly.
So how would you approach that nuance of talking to parents and trying to get them involved, both at a global scale, all parents, but also sometimes at individual cases?
Yeah. So for individual cases, like you were just mentioning, when we look at substance use treatment and treatment for addictive behaviors that is effective with adolescents, it almost always involves the family. That we really need to take a systems approach when we're addressing adolescent substance use. Best case scenario is that the parents are willing and want to be involved in the process, are open to being involved in that process. We know that's not always the case. So I think that can be helpful too, of just gathering that information about parental involvement, whether or not parents are using substances in the home. All of those things I think is good information when we're trying to support a student. So I do think the systems approach, bringing parents in, talking to them about the behaviors that you're seeing, students falling asleep in class or student smells of alcohol, and getting a sense of what's going on at home. And a lot of times parents might be at their kind of end of their rope too, of like, I don't know what to do. And so then we can step in and provide resources for parents. So I've done a lot of trainings for parents at schools who are desperate for information about digital media addiction, gaming addiction, pornography use among teens, vaping is a huge concern right now. And there are parents who are like, I didn't learn this. I don't know how to address this. I don't know how to talk to my teen or talk to my child about these issues. That's where we can bring people in to provide that training for parents. I just did one right before Christmas, and I was just surprised at how many parents were coming to a school auditorium on a Thursday night from 6 to 8 to learn about talking to your child about addictive behaviors. I believe this is something that a lot of parents want to know, but don't have the information. So if school systems can provide this information for parents so they know what they're doing at home, the school system knows what they're doing in the school, that's just kind of wraparound services for the student and for the child that can be really helpful. So I do think getting the parents involved, perhaps referring the whole family system to counseling could be a good step at the individual level. But at the more general level, my experience has been that parents really want this information and they don't know where to get it or how to get it. And so sometimes they turn to online sources or blogs that may or may not be accurate. So providing this kind of information and this training and these seminars for parents at the schools, I think could be such a tremendous benefit.
Thank you very much, Amanda. That's very helpful. Another question is, how do you approach a student who doesn't want to talk?
Mm-hmm. Yeah, very common. There's a couple of ways you could do it. So when we and again, I think you have to differentiate how much does a teacher do versus when do you maybe refer to the school counselor that can use some expressive arts interventions for maybe students that don't want to talk. a lot of times students are testing the adult to say, are you going to judge me? Are you going to evaluate me? Can I trust you? And so by being a consistent, attuned adult in this student's life, that you're showing up, you're doing what you say you're going to do, you're being trustworthy, you're showing that you have concern for this student, over time, that can develop a relationship where they do feel more comfortable talking, that I feel safe with this person. I'm not going to be judged. I'm not going to be criticized or evaluated. So I think just consistency, showing up and being genuine can do a lot. But often what I have seen, from the counseling side of things, is when you bring up substance use or an addictive behavior, the student is anticipating you're just going to yell at them or tell them to stop or give them these punishments. And so there's not a lot of motivation to talk. But if you go about it in a different way of saying, I just want to get to know you. What are some things you value? What are some goals that you have? What does drinking do for you? Why do you like gaming so much? It is almost a corrective experience, because we're showing, I'm here to get to know you, to understand your inner world, and to understand you without evaluating you and without judging you. That's a corrective experience that can elicit more conversation. So I have a good friend, and all she does is work with gaming addiction with adolescents. That's her whole specialty as a counselor. And she said she often starts by saying, what do you like so much about gaming? And the adolescents are like, what, are you just going to tell me to stop like everyone else? And she was like, only you can make that decision. I'm not here to make decisions for you, but I'm genuinely interested. You spend 10 hours a day gaming. What do you like about it? And it opens up all this conversation, because they're able to share about this part of their life that is important to them, to someone who's genuinely interested. And then that leads to rapport building and then getting into MI. So, I think there's a lot of approaches that we can take, but one of the things I keep learning, especially among students who've experienced trauma, is having one consistent adult figure in their life that shows up regularly, that's trustworthy, genuine, and consistent, can make such an impact. And so I would say, if a student isn't willing to talk right away, continue to show up, continue to be attuned, and work on that relationship, and then invite them into some conversations that aren't about addictive behaviors, and see what happens.
Fantastic. There's good insights here, and I could ask how many more questions. But we are running out of time now, Amanda. So I just wanted to give you the opportunity just to say some final takeaways or some recommendations or final words. Like I've said before, we've got a lot of resources available for download via the handout, and you can also check the slides via the event portal. But beyond that, what else would you like to add to wrap up for teachers all over the place that are looking to improve how they impact students through this field?
Yeah, I think I'm just feeling a lot of appreciation right now, just knowing how much teachers do and all the different responsibilities they have. Taking on something like recognizing addictive behaviors or talking to kids about substance use is just another thing, and it's challenging. But for someone who works with adults with addictive behaviors, when they come to like intensive outpatient, part of me wishes that those individuals had a teacher who recognized the signs of addiction and could intervene early. So I just feel this gratitude for everyone who came to this masterclass, who's trying to learn about this topic, because I think it is immensely important. And I just have a lot of gratitude and respect for what you're doing in the schools and for trying to support students in this way. It just encourages me about the future. And I'm just so thankful that you came to this session and that you're taking on this topic, because it's certainly an important one.
Wonderful, Amanda. Thank you so much. Thank you, everybody who's watched this session. Don't forget to attend our next session, which will be in a month for those who are live with us right now, or in less time if you might be watching this in the future. And also remember to invite your professional peers, other teachers in your school or beyond, to sign up. It's a free series, and everybody can get the same takeaways and resources and learnings. Amanda, have a wonderful rest of the evening for you, and look forward to connecting with you again.
Sounds good. Thanks, Pedro. Thanks, everyone.